I believe strongly in self-responsibility. And I believe that if people have access to purchasing insurance, they would also have access to community health centers where they could go and get instructions of how to take care of themselves. For example, if someone is a diabetic and may not know it, but if they went for a test and found out that they did have it, they could get those instructions. And diabetes, for many times, can be controlled by diet. But if they stay home and all of a sudden they're in a coma, they're rushed to the emergency room, it takes many tests with no history. Now, electronic records will help this, but if they have no history of this person and the person can't really tell them anything, they're in a coma, it takes numerous tests to decide what is wrong and how to proceed with the treatment. That is very, very costly. And
not good care for the patient either.
No. As a matter of fact, sometimes untoward things could happen while you're trying to figure out what's wrong with the patient. I've heard lots of comments as well about healthcare rationing when it's public. The only rationing that I've experienced so far is where insurances will tell you what you can give and cannot give, how much you can give it, when you can get a test. Physicians having to wait 2 or 3 days to get permission to do certain tests. That is the only rationing in this country that I'm aware of. Are you aware of any other?
No, and I think to that point, I think a lot of what the reform addresses is making sure that patients have access to care. It's actually it's the opposite of rationing. So as a physician, I'm very distressed when I hear those kind of comments, because actually the reforms being talked about actually invest in physician workforce. So making sure that there's going to be more doctors in your neighborhood and making sure that they're able to keep their practice open to take care of you.
Yes.
As things get more expensive for doctors to run a practice, a lot of these reforms are not only going to provide people with insurance, but they're going to make sure there's a doctor there to see you.
Yes. And we don't have enough right now, most especially in Texas. I'm not certain what many of the doctors are experiencing, but because I've been out of healthcare for a while, but nothing has changed for the better. It has kind of deteriorated. It's much less accessible to people. In Texas, we have working people that don't have access to care, to insurance, and I don't know that anyone could suffer some type of catastrophic disease without insurance that's going to make it without taxpayers picking up the tab. And I don't know how we can get them health care coverage because that opportunity is out there now if the insurances would allow them to be covered. But they have either been rejected because of some diagnosis, or it's too costly for whomever they're working for. I'm really in a dilemma because we really need this reform, and I have not heard any answers to those questions. Have you had any discussions?
Well, I think that we know that there needs to be a doctor available for every physician. So as we work to increase coverage, we want to make sure that we work to make sure that access to physicians is lock and step in that process. So we know that in the private insurance market with a pre-existing condition, that if you change jobs, you're at risk for not being able to get health care. And that's not what our country should be about.
No.
It should allow you to take opportunities and new jobs, start your own business, and not have to worry about, will my high blood pressure get covered? Will the diabetes that I know runs in my family get covered? So those are the important things that we are so pleased that are getting addressed in this health reform. And again, on the flip side of this is that once you do have insurance, is access to a high quality physician. I think what you touched on before also with the health information technology is really going to make our system a true system. Talking about Veteran Affairs, since both of us have worked in Veteran Affairs, for over a decade has had health information technology and a very sophisticated medical record that has improved care for our veterans.
And saved money.
And saved money. And so, we have lessons to learn right in our own neighborhood across the country. And so I think, Congress has already recognized this and made a huge investment in health information technology, and I think that's going to be extremely important for our patients going forward. And, I look forward to that being rolled out over the next year.
Well, I know there are many people that are very concerned about getting a big free system. The thing of it is that most of the people that don't have insurance are getting a big free system now because they're not paying. But with this coverage, everybody pays. They pay according to what they make, but everybody pays. And I think that there has been some false information or misconceptions explained to people, because the biggest fear that I've heard the people who feel they're against it is that it'll be a big system that we have to pay for. They're paying for a big system right now where patients don't have the money and insurance. But with this system, everybody pays. And that would really cut the cost for even the persons who are covered by insurance.
Right. We want to spread the risk out over everyone so that each of us has to pay less. And there's been research out there that shows about $1,000 of our premium is that hidden tax that you keep talking about. It's an enormous amount of money that we are paying into a system that we're not getting a return on. So let's do it smart. There's a lot of really smart people in this town and around the country, and so I think these are good steps forward to create a system that makes sense.
Are you aware of any difficulties that physicians have now in the current system of practice?
There are many, and what I like about these reforms is the fact that we don't scrap everything and start over from zero. We build.
Just correct the problems.
Yeah, exactly. There are things that work. Let's keep what works and fix what's broken. And so that's what So one of the big problems that physicians often are fighting with private insurance companies to get their patients the care that they need. They have to hire a separate person just to call up the insurance company day after day to make sure that their claims are processed, then make sure they get pre-approved for the tests that they order or the drugs that they want their patients to be on. So, doctors, have to struggle with that system already. And so anything that will work to improve that for our patients is going to make the system easier for our physicians. And another part is that we also know that physicians are due for a 20% payment cut next year in Medicare. Across the board, it's an old system. Everyone knows it's broken. But a 20% cut, think about what a 20% salary cut is to a physician that's already a primary care doctor in Texas that's teetering on whether or not they can keep their doors open.
That's right.
That makes me worried. And so, some of these reforms make the step to make sure that physician payments aren't cut by 20% next year. So primary care physicians in your district can keep their offices open for our patients. So,
well, it's costly for a physician to practice medicine, and it is unfair for them to have to take care of a lot of patients and have no way of collecting what they're owed. That's another part of the system that is really broken. If we could get a bill that corrects these problems, I think you would see physicians getting paid correctly. You'd see a lot less costly care delivered, and things would indeed be better. I hear all these prices about it's going to be $1 trillion and all. Well, the truth of the matter is we're paying more now than what we'd be paying with these corrections, because money would actually be coming back into the system. When you get the 47 million people uninsured,